Without objection, your written statement will be made part of the record. With that, Mayor Lightfoot, you are now recognized to provide your testimony.
Thank you, Congressman Krishnamurti and Congressman Foster and members of the Select Subcommittee on Coronavirus Crisis for holding today's hearing. I applaud your work and the unwavering support that you've shown municipalities across Illinois. Though this journey is far from over, it's an honor to appear before you today to share the work that we've accomplished thus far and our plans for the future, which would not have been possible without cooperation from the government at all levels. So I want to again thank the members of this body for the resources that have been provided to municipalities like Chicago. I also want to thank our state partners represented today by Dr. Ezike, who has been very instrumental in making sure that we're focused and coordinated in our efforts with the state. From the moment COVID-19 hit Chicago, we were determined to listen to public health experts, follow the science, and address its effects and equity, include our residents in the progress that we were making towards mitigating COVID-19. Thanks to this, we saw extremely strong rates of residents cooperating with public health orders and developed an equally strong, community-led, hyper-local response. We have been able to build vaccine confidence in our city because we started early on working with local leaders across disciplines to build a robust citywide response. This started with our recognition that all of Chicago was impacted by COVID-19. Our Black and brown communities really bore the brunt. And for example, in April 2020, and despite making up only 29% of Chicagoans, Black residents accounted for 75% of COVID-related deaths. That was 7 times the rate of any other demographic. And to address this glaring and unacceptable disparity, my team, alongside with community partners, created the Racial Equity Rapid Response Team, or RERRT, which forged partnerships with trusted community messengers across disciplines and utilized trusted locations to provide residents with information, testing, and eventually vaccine. And while this started with a focus on deaths in Black Chicago, we soon widened our aperture and worked to build the same kind of trusted relationships across Latinx Chicago. To bolster this data-driven, hyper-local approach, we launched initiatives like Protect Chicago Plus, in which we sought to vaccinate multiple generations within the same household simultaneously by going deep into these communities that were showing sustained rates of high case infection. Here again, we used a network that we had built for testing and education to make progress in our hardest-hit zip codes. We also then created Protect Chicago at Home, which mobilized our paramedics and vaccinators to provide in-home vaccinations for homebound or disabled residents, and has been available to all residents free of charge since June of this year. To date, more than 15,000 people have been served through this Protect Chicago at Home program and counting. It's very, very popular. And as of the last 4 weeks, 54.6% of the participants in this program were Black and 18% were Latinx. We also created a 600-strong workforce of contact tracers, and we specifically targeted the underemployed with an earn-as-you-learn approach. Not only have they been doing contact tracing, but they've also been deployed to be vaccine ambassadors in their communities. Recently, as you mentioned, we launched Protect Chicago 77, which engages individuals in every single one of our 77 communities to ensure that at least 77% of residents aged 12 and over have received at least 1 dose of COVID-19 vaccine by the end of the year. These efforts have helped to save countless lives, including Maria and Jesus, parents of Portage Park resident Ceci. Ceci and her parents were desperate for a vaccine appointment when they met Brianna, who volunteered to connect them with vaccine appointments for residents after losing her grandfather to COVID-19. 24 hours later, Ceci secured an appointment to protect her parent. Ceci's story and the story of countless others were made possible by the many volunteers, community leaders, and organizations who continue to pull their time, talents, and resources together to protect our most vulnerable communities and have allowed Chicago to retain its reputation as having the most equitable vaccine distribution strategy in the country. I want to emphasize a couple of data points in my closing seconds. 99.1% of fully vaccinated Chicagoans have not tested positive for COVID-19, whereas 99.9% have not been hospitalized and 99.9% have not died due to COVID. These numbers are pretty remarkable, but the flip side is the case for folks who remain unvaccinated. My time is up, but I appreciate the opportunity to speak with you here today.